Let's talk about pelvic floor dysfunction in teenage athletes. When we talk about the development of pelvic floor dysfunction in teenagers, we are not talking about an obvious injury, which is commonly what most people understandably think about. We are talking about the insidious development of subtle symptoms that then become pathology. This can involve urinary urgency frequency, constipation issues, and issues with pelvic pain, various issues that they may not pair to their physical activity or think to talk about or want to talk about. These symptoms are signs of pelvic floor dysfunction that are very common in teenage developing athletes as their muscles are developing, their bodies are developing, and the intersection of hormonal health comes into play. But these issues are treatable impairments that will not only affect their performance for what the sport is that they're trying to play, but their overall pelvic health and well-being. When teenage athletes leak urine, they are often told that they need to do Kegels and strengthen their pelvic floor. We can take a pause and think for a minute, how on earth would a teenage athlete have a weak pelvic floor? Instead, what is likely happening is a discoordination between their pelvic floor muscles and their abdominal wall that can be remedied with pelvic floor physical therapy. Part of the job of a pelvic floor physical therapist is helping people understand how to use their pelvic floor in coordination with their muscles so these symptoms don't occur. So in addition to the discoordination issues, some of the problems that can present for teenage athletes are the introduction of various medications. This can be for things such as acne, not getting your period, getting your period too quickly. Oral birth control pills are prescribed for all of these things, and that can also interfere with the ability of the pelvic floor to function normally because it's creating a hormonal deficiency similar to that in menopause. It's important to remember that these symptoms are extremely common in teenage athletes. Do not be embarrassed and do not be afraid to talk about it. Sometimes pelvic floor physical therapy may be all that you need.